Well, today's a Patients' Day for patients with inherited eye disease. And the main reason for having the day is that I feel that patients are brought together and given a voice to express the need, and the unmet need indeed, for inherited eye disease. There are lots of people who don't have any support networks, who don't have any ability to talk to people with the same condition, who've never met people with the same diagnosis. And it's a real jungle out there for them to navigate support, whether it be educational support or support for low vision. And so today was an initiative really to try to start the conversation for some of those people, to establish networks and to actually try to build patient support groups. One of the things that we're really aware of is that with social media, the internet and so on, it's never been easier for these people to get together, and yet they don't know who to contact. So we're hoping today we can give emails to all the delegates so that they can start talking to each other. And the RNIB who are here, for example, the guide dogs, Sight Cymru, RP Fighting Blindness, they're all committed to trying to help patients get together in support groups and join the relevant networks so they can talk about their condition and try to improve their treatment.
I'm delighted to be here today as RNIB Cymru Director. I think Marcela has done a fantastic job in pulling this group together. I think it's a patient group that hasn't traditionally had a voice, and we need to find ways to work in partnership to address that and to make sure some of the key issues that we've highlighted here today are actually taken forward.
We're from Guide Dogs Cymru, and we're really here today so that people come and talk to us. Sometimes people find it difficult to approach guide dogs, and if we're a bit more visible today, then they can ask us the questions they'd like to know.
We actually have a session about establishing patient support networks and new groups. We're very fortunate to have the Genetic Disease Alliance here, and they're going to really front that for us and allow patients to try to get together and network.
So my name is Sue Drew. I'm the engagement manager for the charity RP Fighting Blindness, but I'm also, possibly more importantly, I have a family affected by RP. My son and my brother have RP, and my daughter and myself and my mother are carriers, so it's quite prolific in our family. And it gives patients access, time to ask professionals questions they might not have time for in the clinic, but also to connect with the third sector, like guide dogs who are here today, Sight Cymru, myself from RP Fighting Blindness, to get information and just ask questions and get signposting. Often it's signposting, to the relevant service, or even talking, actually more than that, talking to another patient and you happen to share a piece of vital information you might not have got otherwise, just in general conversation. Someone will say, well, I did this, why don't you try this? And you have that in common, because nobody really understands your eye condition as well as you do. These days are so important because there's so often so little information for patients with either rare diseases or inherited eye disease, and we constantly via our helpline hear from patients who've had terrible experiences. They feel so isolated and alone after a diagnosis, haven't necessarily had much information about their condition, don't know anybody else, haven't met anyone else, don't have anyone to talk to. And I think, sort of most importantly, the information, but the follow-up support is often missing. So where there's an eye clinic liaison officer in a hospital, and I work closely with them, it makes such a difference, you know, someone there specifically to support the patient.
Patients with inherited eye disease are mainly out there in the community and are not, in fact, in the hospitalised service by and large. So they're not really accessing a lot of the support that's available. So that's one of the reasons why this is an important event. And secondly, because as a head of School of Optometry, I'm very aware that we want to give as much support in the community as we can. Optometrists are ideally placed to take part in that. So we hope that this could lead to bigger things.